It seems like there's an app for everything these days. More than 10,000 are out there related to mental health, but only about 1% of them actually have reliable evidence for their effectiveness. Most of them haven't even been developed with input from mental health professionals. So with your mental health in mind, this morning we are talking about whether we should be using these apps. Joining us is our wellness expert, psychotherapist Heather Hans. Heather, good morning.
Good morning, Gary. Great to see you.
You too. So why has so little research been done on these apps?
Yeah, it's surprising, but reliable research is very time consuming. And this is a profit driven market where apps are being constantly updated and dropped. And the research that has been done by people or organizations that are affiliated with the app. So that makes it unreliable. But the apps do have the potential to help people with mild to moderate mental health issues, people in rural areas, lower socioeconomic groups, and also kids and teens.
What kinds of questions should we be asking either ourselves or the app people when we're thinking about using these?
Yeah, the first question I'd ask is it easy to use? You want to find an app that really works for you. And some of the therapy apps have glitches that people complain about. And I know everyone's on their phone too much already anyways. So you want something that's smooth and efficient. And some of the apps are very simple, like ones that help you pace your breathing. And then they go all the way up to ones that allow you to talk with a mental health professional. Another question to ask is, do the app's features align with my priorities? And you can talk to a mental health professional via text, voicemail, or video in some of the apps. And then some you do on your own, like mindfulness apps and ones that help you track your thoughts and feelings and behaviors. So it's really a matter of what level of support people need. And the apps can also be supplemental to other mental health work that you're doing. And then after you've used an app for a while, you want to ask whether you're noticing a positive change or you've learned a new skill. So most of the work falls on the user of the app. So like anything, you're going to get out of it what you put into it, but you do want to track your progress. I actually worked for one of the therapy apps for a while, and I found that it wasn't good for clients with anxiety to be able to contact their therapist 24/7 because it goes against the goal of self-regulation. So these apps are being developed by people without mental health training. So you really have to be your own advocate here.
And so to continue that thought, with thousands of apps out there, how do you find a good one?
Yeah, the American Psychological Association has a website called App Advisor where they teach you how to rate the apps, and they've actually done some of them themselves. And then people could just go into the App Store and search for what they need help with. And as always, private therapists are available to help people, and most of them offer remote sessions now too.
All right, good advice. Heather Hahn, as always, good to see you.
Thanks so much. Great to see you.